Hi, I'm Sarah, and I'm going to be delivering an in-service information session discussing the issues relating to Aboriginal and Torres Strait Islander people's health outcomes. For many decades, Aboriginal and Torres Strait Islander people experience a major health disadvantage all over Australia. This is further impacted by where they are currently living, whether that be in remote areas or major cities. They are all affected to some degree. Some of the key health disadvantages they may experience include higher rates of chronic diseases, lower life expectancy, mental health challenges, higher rates of substance abuse, limited access to healthcare, social determinants of health, and higher rates of infectious disease. So that brings me to the chosen issue that I'm going to discuss with you today is closing the gap. In 2007, the Commonwealth, state, territory, and local governments made a commitment to work together to close the gap in Indigenous disadvantage, to all come together and bring the next phase of delivering a community-led, strength-based approach. So, the gap refers to the differences in health, well-being, and life expectancy between Aboriginal and Torres Strait Islander people and other Australians. In 2018, the burden of disease impacted Aboriginal and Torres Strait Islander people 2.3 times more than non-Indigenous Australians, with the leading contributor to that was substance use disorder. Between 2018 and 2019, it was found that 30% of Aboriginal and Torres Strait Islander people who needed to visit a doctor did not. They were faced with barriers such as cost, specific health services that were too far away to travel, or because of waiting times being too long. In December 2018, Closing the Gap Refresh. Government and Aboriginal and Torres Strait Islander people joined forces to work together to achieve greater progress in the future, as this gives increasing involvement and support for local communities to set their own priorities and tailor services to their own specific needs. There are many outcomes with targets to reach, and some of those include closing the gap on life expectancy within a generation by 2031, increase the proportion of Aboriginal and Torres Strait Islander babies with a healthy birth weight to 91% by 2031, also reducing the significant amount of suicide deaths of Aboriginal and Torres Strait Islander people, and we want to bring that down to 0. So there's a lot of different ways we can close the gap, and I feel like it's very important for everyone to be on the same page with it, especially going into this as nurses and midwives, and to create a workplace environment that we all are on the same page, I feel is very important. Which brings me to what we can do to help. So us as nurses and midwives can contribute to closing the gap in health services by providing culturally competent care that respects and acknowledges the cultural beliefs, values, practices, and understanding of the Aboriginal and Torres Strait Islander patients. We can also engage in health promotion and education within Indigenous communities to raise awareness about important health issues, preventative measures, and what healthcare services are available. As nurses, we also have the power to advocate on behalf of our Aboriginal and Torres Strait Islander patients, to develop and implement strategies for improving health outcomes and address any health concerns they may be experiencing. We also have the voice to collaborate closely within the healthcare team of professionals, including doctors, therapists, pharmacists, ensuring patient care and treatment plans are implemented and effective to each individual patient. The Nursing and Midwifery Board of Australia has implemented expectations surrounding culturally safe practice to provide a culturally safe health system for all. As nurses, we are expected to engage with all people as individuals in a culturally and respectful way, with honest nurse-to-patient professional relationships, and to ensure we adhere to their obligations about privacy and confidentiality. Some realistic strategies that would help in closing the gap in our workplace could include education amongst all employees, as it gives better understanding on the issues that are affecting Aboriginal and Torres Strait Islander people, such as tragic historical events that occurred in our shared history, the persistence and ongoing health issues that the concepts that are important to Aboriginal and Torres Strait Islander culture, such as the dream-in, language, law, the environment, family, and kinship. Those are all important factors that we need to take into consideration. Another important aspect we as nurses can implement in the workplace could be to hold an event each year on the National Close the Gap Day, as it usually does occur in March, just to symbolize like we know what's happening and we're here to listen and take on all the advice. I feel like that would be really beneficial to do. It would be a great way to bring knowledge and support to the local community, and a great way to surround each other with positive attitudes to encourage better health outcomes for Aboriginal and Torres Strait Islander people. The New South Wales health sector highlights their approach on closing the gap with having culturally competent staff, a culturally safe workplace, and culturally respectful health services. They have the following domains to guide them as leadership, consultation, and partnerships. It goes on to explain the data, the evidence and evaluation, the policy and procedures, strategic and service planning, specific Aboriginal health initiatives, resource allocation and accountability. And also recruitment and retention, staff education and training, physical environment and performance monitoring, and feedback across all areas, which I feel is very important, because that's when you're going to know if it's going the right way or the wrong way. These domains not only identify physical well-being of Aboriginal health, but also the social, emotional, and cultural well-being of the whole community, which is as utmost important. So I'd just like to say thank you so much for joining me in this presentation, and I hope you found it beneficial. I'm looking forward to implementing some of these issues within our workplace.